Americans have faced countless challenges over the last decade, many of which persist today. What we may not realize is that these ongoing social challenges threaten our physical and emotional well-being. Many are unsure about how our future health needs will be met. At the same time, we're riding a financial roller coaster that has left many unemployed and others homeless. Stress caused by financial concerns, family responsibilities, and other sources poses a serious health problem for Americans. A 2009 American Psychological Association survey found that 75% of people are living with moderate to high stress, and nearly half report that their stress has increased. 2/3 of Americans are overweight or obese, and many will develop diabetes, heart disease, and other chronic illnesses in their lifetime. Chronic illnesses are often brought on or made worse by unhealthy lifestyles and behaviors that many people rely on to manage their stress. APA's 2009 Stress in America survey found that healthcare providers regularly recommend that adults make lifestyle and behavior changes to improve their health. Alarmingly, patients with higher levels of stress or those who were asked to do things associated with stress management, like quitting smoking or getting more sleep, were largely unsuccessful. We need to establish a U.S. healthcare system that focuses on prevention and wellness, a system where psychologists are at the center of an integrated approach to healthcare delivery. Psychologists, as doctorally trained healthcare professionals, are uniquely qualified to help people make lasting lifestyle and behavior changes that can prevent illnesses or lessen their effects. APA's strong grassroots network of psychologists connect with people in their communities, educating the public about the important role of psychology in managing physical and emotional health. Thanks to these psychologists, APA is well positioned to respond to social challenges nationally and locally. When traumatic events occur, APA's public education and disaster response coordinators partner to offer guidance on building resilience and managing the emotional effects of these tragedies, often using articles and tips from the APA Help Center and the Mind Body Health Toolkit. APA's Mind Body Health campaign educates the public about the link between physical and emotional health. The campaign combines behavioral health research and public opinion data about disease management, stress, and lifestyle. Campaign messages reinforce how psychologists use evidence-based strategies to promote lifestyle and behavioral changes that help improve people's health. APA conducts an annual Stress in America poll to help Americans understand the causes and consequences of stress and how to effectively manage stress. Poll findings were featured in thousands of news stories about stress, health, lifestyle, and behavior in 2008 and 2009, generating more than $6 million worth of publicity for psychology. Workplace stress costs U.S. industries hundreds of billions of dollars annually, and findings from the Stress in America poll indicate that it is a major concern for women and families. The campaign's focus on lifestyle and behavior and stress management creates partnership opportunities with APA's Psychologically Healthy Workplace program. Over 400 organizations have been recognized with Psychologically Healthy Workplace awards at the local level, and APA has presented 87 awards at the national level, expanding psychology's visibility in the workplace.
Your effort to promote healthy workplaces is truly a worthwhile and meaningful contribution to society.
Partnering with community organizations and state, provincial, and territorial psychological associations is an important strategy that has helped APA engage people in meaningful ways. In 2007, APA and the Georgia Psychological Association hosted a mind-body health fair in Atlanta, showing that psychology can be at the center of a health fair. Now, GPA has plans to take the fair to its state legislature to advocate the role of psychology in healthcare. In 2008, APA worked with Division 42 to establish a partnership with the YMCA, the nonprofit with the most powerful U.S. brand. In 2009, APA and the YMCA released co-branded materials that focus on family lifestyle changes that promote good health. With over 2,600 YMCAs in America serving more than 20 million people, APA has a new venue to directly connect psychologists to the public. APA's award-winning online help center provides valuable information about emotional and physical health. The Help Center provides access to APA's Psychologist Locator, helping those in need find professional mental health services. The Centro de Apoyo is the Spanish language equivalent of the Help Center and provides Spanish-speaking visitors with the same resources as those available in English. People who prefer to get information from social media services can follow the Help Center on Twitter to receive updates about mind-body health and psychology. The Your Mind, Your Body blog, written by psychologists and geared toward the public, provides commentary and insight on health, lifestyle and behavior, and everyday stressors. Attention to the information needs of diverse cultures has been a cornerstone of the public education campaign. APA's Guide to Cultural Awareness is a new tool for psychologists engaged in community outreach and disaster response activities to help them consider the cultural needs of the people they work with. It offers practical tips to further psychologist cultural understanding. As we look to the future, APA has an opportunity to continue its focus on health promotion and disease prevention. In 2010, APA will continue to put a face on practicing psychology using visual tools and social media to highlight psychologists' education and training and demonstrate the varied settings where psychologists provide services. APA is up to the challenge, ready to respond to society's healthcare needs, positioning psychologists as integral and essential to primary health care.